So welcome to the Venture Café Presents. I'm Christine Dunn. Joining me today is Ramesh Kumar, founder and CEO of Zaki Point Health. Thanks so much for joining us today.
Thank you for having me. It's
So
exciting.
Tell us a little bit about Zaki Point Health, what you're trying to do and how you're trying to achieve it.
Sure. So the biggest problem that we are really focused on is, employers in the US are spending a lot of money on their employees' healthcare. So self-insured employers are spending about $610 billion on the employees' healthcare costs. And that's doubled over the last 10 years. So what's really happening is these employers don't know what is driving these costs.
Mm-hmm.
And there are real inefficiencies and lack of transparency in the system. So what we are doing is we're providing them the ability to understand what's driving costs, what actions can they take, and how can they really deliver transparency to the employees to make the right choices about where to go for care.
So when you're looking at the market, first of all, how do you obtain your data if there isn't a lot of transparency in the market?
Yes, very good question. So what's really happening is, first of all, there's a lot more data is being made available by the government, by the various kind of bodies that are involved in the whole Obamacare move has been to collect a lot more data. And secondly, we actually get the employers' data through the carriers themselves. So by bringing those variety of data sets, we're able to kind of provide this transparency as to where the costs are, where the inefficiencies are, which of the providers are actually really high cost and truly are not delivering quality care.
What incentives, though, do the providers have to give you that data?
Yes, so they may be kind of reticent to share this today, but there are enough kind of, the train has already moved on in terms of requiring them to share this data with the carriers, with the kind of broader system, with CMS. So a lot of the data is now available. But we do see this will be an impediment for kind of really truly bringing the transparency to the market.
So do you have all providers across the country providing it, or is it just pockets of groups that are providing it?
Pockets. Massachusetts is one of the leaders in this, and there are things like all payers claims data sets in Massachusetts, and there are a bunch of states that are very forward-looking, and they are providing this data to innovators and bodies that can actually do something meaningful with this data.
Mm-hmm.
So there are pockets in the country.
So then how do you deliver it to the employers? Do you provide them with a report? Is there some kind of dashboard? Like, how do you deliver this information to them?
Sure. So technology has really moved on to quite a level where all this stuff could be available at any time. So what we have is a platform, and it allows the employer and the employees to be able to access their relevant data and their relevant insights and choices either through a desktop application or through a mobile app.
So they would input their own company's data in there and then do a comparable?
Yes. So the employers, we take their data, map it against the benchmarking data to show them what are the inefficiencies in their kind of spend. And when the same data is being shown to the employee, it's showing their data over the last few years, where their spend has been, where they've gone for care, and if there are any inefficiencies in the care that they have received, how they could modify their choices.
So when you say inefficiencies, can you give me examples of, say, the 3 biggest inefficiencies that you've been finding over the last few years that seem to be most common among these self-employed companies?
Very good question. I mean, I think now we are getting into some of the secret sauce. And actually, I hope everyone should know this.
Uh-huh.
So at an employer level, we are seeing real inefficiency around the pharmacy benefit costs. People are talking about specialty drugs driving costs. To give you an illustration, some of these specialty drugs could be as much as $300,000 per member who's consuming it. And there are huge variants in terms of where you purchase them, whether you get mail order, whether you get it from the prescribed places where you have your card that you can go and purchase these drugs. Or you might actually be going to Walmart to purchase these drugs, not these specialty drugs, but many of the other ones. So we are finding tremendous inefficiency in this whole pharmacy benefit space, where people purchase drugs can be twice as expensive in some scenarios. The other areas that we're seeing a lot of inefficiency is, just a lot of money and time is spent on programs that are really not effective. Mm-hmm. So an example of this might be a company might be providing these diabetes management program or other kinds of programs that many people are not even participating. And if they are, they're not really effective in doing anything. So really getting those programs optimized. At an employee level, the huge difference that we are seeing and the variance that we're seeing that's driving up this inefficiency is something simple like MRI that we need to do when you go into the hospital, you need to get done. That could vary from $700 in one location to about $3,000 at a location half a mile down the road. Mm-hmm. And nobody knows this. Not only the individual knows this, not only the employer who's paying for it, but interestingly, the doctor who's prescribing that MRI, saying go down the hall, they often don't know what things cost. So what we are doing is we're providing that at the tip of in their hands, being able to access this information so that they can make the right choices about where to get that MRI done. So there's a lot of those due to the lack of transparency. There's a lot of those inefficiencies in the system.
So let's tackle each one of those then. So for the pharmacy benefits, how can an employer, based on this information, drive their employee behavior in order to become more efficient? What are some potential options that you offer through giving them insight into this data?
Great. So this is a tough part. It's a tough nut to crack. Changing behavior has always been very, very difficult. So there are incentives you can provide through plan design, which say, okay, you should get this through mail order. And mail order is not only cheaper, it's more convenient to you, and you can actually get refill when you really need it, as opposed to, I ran out of my prescription drugs and I need to run out and get, so you might lose a day or two, which is not optimal for the patient, not optimal for the system, not optimal for the employer. So by designing the benefit plan towards mail-in or other forms of pharmacy benefits, and then communication, communicating to people that this is really a benefit that's available to you, and thirdly, putting incentives in place. So a lot of employers are working towards whether it's small incentives to shifting this behavior, or the big thing that's going on in the industry is consumer-driven health plans. Mm-hmm. What that really means is you and I are paying a lot more from our pockets now. Mm-hmm. Our deductibles are going up from $500 to $1,000 to maybe even $2,000. And what that means is I am actually paying for the first dollar to $2,000. So I do care how much this costs at place A versus place B. Mm-hmm. So some of those incentives are driving this change in behavior as well. And what we need is tools and information that the employees and the employers can make choices.
Mm-hmm. Now, let's talk a little bit about the market you're in, because I hear a lot about how there's a lack of transparency in healthcare, and a lot of people seem to be trying to crack that nut. So who do you see as your biggest competition, and how do you differentiate yourself? Why is your system more transparent than the next guy?
Sure. So it's still early days. I mean, I would argue that we haven't seen anything yet. And when you go and ask a person on the street, he or she still doesn't have access to this information. So the reality is we're still far, far away from in healthcare compared to any other industries. Having said that, there are companies like Castlight who are doing some of this work with carriers and are providing these tools and this kind of information. How we are different is, first of all, we believe the middle market self-insured employers are really not being taken care of.
Mm-hmm. And can you define what that size company is?
Sure. So companies that are 350 employees to about 5,000 employees, and there are a lot of them. Mm-hmm. They're all self-insured. They don't have access to maybe as much, tools, technologies, or sophistication, because they may have one or two people really managing all this in their companies. So they don't really have access to all this, and we believe they are the ones who've been left behind, and they are the ones who are proportionally paying more and feeling the burden. So some of our customers like manufacturing companies. Mm-hmm. So this is the market that's been underserved or poorly served. What we are doing is different for them is we not only provide this to the employees, we also provide it to the employer, and through our platform, we make it actionable. A lot of the time, data for the sake of data can just be more data. Right. And so we really are, our analytics tied to what actions people can take.
So you provide solution options.
We do. So we are building a marketplace so the employer can connect the dots. When you look at, okay, this is what's driving my cost, the PBM option as I described here, I have a better alternative in our marketplace that they can directly contract with for PBM.
Interesting. Talk a little bit about how some companies can optimize some of these programs, because these programs are kind of on the rise, aren't they? They're trying, a lot of employers are trying to institute things like diabetes management programs in order to improve the overall health and productivity of their employees.
Sure.
So what are some examples of solutions that your system has discovered and offered based on the data on how to optimize some of these programs?
Sure. So I'll just paint a higher level picture first. So, wellness programs have been a fad. They've been, for the last 3 to 5 years, we've seen a lot of different wellness programs being put in place. And what we are seeing through data is many of these programs, while great at getting the 10% people engaged, it doesn't really do much for the 90% of the people, and particularly the people who are, let's say, have chronic conditions or have diabetes or other things. So what our system has really been able to help people is to really divert their attention from, okay, let's chase the next, Fitbit kind of program,
Right.
to, what, you have a very small portion of your population that's diabetic. They actually don't even know that you have annual foot and eye exam program available to them.
Mm-hmm.
And just making it, communicating it and making it more readily available and maybe driving better engagement through that diabetes program might be a better thing to do. So it's more about diverting some of that attention from things that may not be delivering results. In some cases, it may be. So really, it's all about bringing data to the forefront so people can redirect these, valuable dollars to the right program. So in some cases, it could well be diabetes management program. In other cases, we have seen is simply some cases that are, in chronic, not just chronic conditions, but situations where somebody's come out of an operation,
Mm-hmm.
and they don't have the right kind of case management in place,
Mm-hmm.
or in some other cases, cancer patients. Nobody wants to be going into the hospital for more kind of medication and other things, and often they don't have the right kind of direction. They don't have the right kind of case management in place to deal with what they need to do when they are in that situation. So just being able to put case management in place for many of these middle market employers is hugely valuable, both for care and for cost.
Right. Tell us a little bit about the name of your company and why you named
Sure.
it Zaki Point Health.
Sure. So Zaki Point Health. Zaki, it's 2 different words put together. I really believe in bringing different things pulled together. So Zaki in Arabic means intelligence, and point refers to data points.
Okay.
And so when you look at our logo even, it's really connecting the dots and connecting the points in an intelligent manner so we can help our customers point upwards.
Oh.
And also happens to be the pattern is the Z of Zaki Point Health.
There you go.
So-
Very nice. Well done.
Thank you. Thank you.
Talk to me a little bit about entrepreneurship. If you had to identify 2 lessons you've learned as an entrepreneur, what are they?
Yeah, it's
sure there are a lot of
those
lessons.
2 also keep evolving
Right.
as we learn more about through our journey. I would say the 2 things that are very much on my mind right now. First is, for any new venture, for any new undertaking that is disrupting the norm, you need incredible people on your side. You need incredible team members, incredible advisors, incredible mentors all around you. So building that team and surrounding yourself with the incredible people is the number one thing that's going to help you to achieve your goals and achieve your company goals. So that being the first thing. The second thing, as an entrepreneur, yes, you have your daily kind of challenges. Yes, you have your daily deliverables. It's a real test of leadership. And every day you have to really challenge yourself to be a better leader who can paint a better picture for customers, for investors, for team members that you're attracting. Be a better leader and set the example to actually do things that are very hard to do. And as a company evolves, what it needs changes all the time. So being an effective leader is, I would say, number two thing that you really have to be constantly working on.
How has your definition of leadership evolved as your company has evolved?
So, when you are just a man in a garage or a person in a garage, you literally have to think of your role as somebody who's just breaking down walls and going through things to get people excited about what you're doing and the little idea that you have. And that role really very quickly evolves, and you have maybe few people on your team, and maybe a crazy customer who is excited about what you're offering, to really focus on, let's deliver value here. Let's focus on understanding what this customer really wants. And so the leadership is all about asking the questions that are not being really asked, through to when you're at a slightly different phase where you might have a bigger team, but you still are disorganized, you're still a startup, and you still don't have systems and processes in place. Your role very much becomes, how do you set the example, but at the same time you're able to drill down into the details of getting something done.
And you also pull yourself out and see the 30,000-foot picture.
Absolutely. And so execution becomes key. So you need to be able to work at both those levels. And so the role keeps evolving, and I guess that is the best part of entrepreneurship. You get to play those roles and
all the many
live
hats.
that and live that, and the ups and downs. Yes.
Great. Well, Ramesh, this has been delightful. Thank you so much for joining us here today.
Thank you for having me. Appreciate it.
For the Venture Café Presents, I'm Christine Dunn.